Welcome to Brain Explained. In today's video, we will go over the science of anxiety. A lot of people often interchange fear with anxiety. Well, anxiety is more than just feeling nervous before a big presentation or worried about an upcoming event. It's a complex emotional state that can manifest in various ways, impacting both your mind and body. In this video, we will uncover the neuroscience of anxiety disorder and everything you need to know about the condition. Let's go. An anxiety disorder is a type of mental health condition that makes you respond to certain things and situations with fear and dread. But did you know that it's normal to have some anxiety? You may feel anxious or nervous if you have to tackle a problem at work, go to an interview, take a test, or make an important decision. Anxiety can even be beneficial. For example, anxiety helps us notice dangerous situations and focuses our attention so we stay safe. But this is where a but comes in. An anxiety disorder goes beyond the regular nervousness and slight fear you may feel from time to time. It interferes with your ability to function, makes you overreact when your emotions are triggered, and most of the time, you can't control your responses to situations. Symptoms of anxiety disorders. So how can you recognize anxiety? Well, symptoms of anxiety disorders vary from person to person, but they often include feelings of restlessness, irritability, difficulty concentrating, sleep disturbances, and physical symptoms like rapid heartbeat, shortness of breath, as well as gastrointestinal distress. Some people may also experience a sense of impending doom, excessive worry, or a constant need for reassurance. But what makes it so terrible is that these symptoms can significantly interfere with daily life, causing distress and impairing social, occupational, and academic functioning. This is why it is important to recognize these symptoms and seek treatment if they persist. Before we go into treatment of anxiety, let's see what causes it. Causes of anxiety. Unfortunately, the exact causes of anxiety disorders are unknown, but according to research, it is believed that it involves a combination of factors, including genetic factors and social stress. For example, a study conducted on general anxiety disorder suggests that the RBFOX1 gene may be involved in the development of anxiety-related conditions since it is a high-level regulatory factor in early brain development. This led to a conclusion that both genetic and non-genetic factors play a part. But generally, some particular things have been discovered to trigger anxiety. Things like health issues, the use of substances such as drugs or caffeine, lifestyle factors such as financial worries, being alone, being with a lot of people, conflict, reminders of past trauma, and so on. There are also certain circumstances that can predispose you to anxiety. Personality traits, such as shyness in childhood, past experience of traumatic events, a family history of mental health challenges, and some physical conditions, such as a thyroid disorder. Types of anxiety disorders. Interestingly, anxiety disorders are the most common mental health conditions in the US, affecting about 40 million Americans. And there are several types of anxiety disorders: generalized anxiety disorder GAD, panic disorder, phobias, separation anxiety, and so on. With GAD, you may feel extreme and unrealistic worry and tension, even if there's nothing to trigger these feelings. And on most days, you may worry a lot about various topics, including health, work, school, and relationships, worrying constantly from one thing to the next. But in the case of a panic disorder, you get intense, sudden panic attacks. What stands out here is that these attacks come with stronger, more intense feelings than other types of anxiety disorders, with or without a trigger. For phobias, it manifests as intense fear of certain situations or objects. Now, some of these fears may make sense, such as a fear of snakes, but usually the level of fear doesn't match the situation. The neuroscience of anxiety. It all starts in a tiny almond-shaped area called the amygdala. This is your brain's fear center, acting like an anxiety alarm that gets triggered whenever your brain detects a potential threat. And when the amygdala sounds the alarm, it sends out signals to stir up your body's stress response system. This kicks your brain into high gear, releasing hormones like adrenaline and cortisol that get you prepared to face the perceived danger. So your heart pounds faster to pump blood to your muscles, your breathing rate increases to take in more oxygen, and your senses become super sharp until you're on high alert. While this anxiety reaction can be life-saving if you're actually in danger, for many people it gets set off even when there's no real threat around, like before a crowd, or when worrying about the future. That's because the amygdala is hypersensitive and sets off false alarms. Meanwhile, a brain area called the prefrontal cortex is supposed to step in and put the anxiety brakes on the amygdala when it overreacts. But in people with anxiety disorders, regulating this response doesn't work properly. So what eventually happens is that the amygdala keeps firing signals that put your body into overdrive with anxious physical and mental symptoms, even when your logical brain knows there's nothing to actually fear. So how are anxiety disorders diagnosed? Diagnosis of anxiety disorders. To be able to accurately diagnose anxiety disorder, your healthcare provider will begin with a complete medical history and physical examination. Interestingly, there are no lab tests or scans that can diagnose anxiety disorders. So if your healthcare provider finds no signs of physical illness, they may refer you to a psychiatrist or psychologist, since they specialize in diagnosing and treating mental illnesses. They would then use specially designed interview and assessment tools to figure out if you have an anxiety disorder, basing the diagnosis on your reported symptoms, including how intense they are and how long they last, discussion of how the symptoms interfere with your daily life, and their observation of your attitude and behavior. While this might sound a little complicated, the good news is that researchers are learning ways to help anxious brains get back in balance. Treating anxiety disorders. Treatment options for anxiety disorders may involve individual therapy, medication, or a combination of both, depending on the severity and need. Treatments like cognitive behavioral therapy (CBT) can help individuals develop coping strategies, challenge negative thought patterns, and overcome specific fears and triggers. Exposure therapy is a form of CBT that gradually exposes individuals to feared situations or objects, helping them develop resilience and reduce avoidance behaviors. Other therapeutic approaches, such as acceptance and commitment therapy (ACT) or dialectical behavior therapy (DBT), may be beneficial for certain individuals or specific anxiety disorders that cause severe daily distress. Also, utilizing community resources such as parks, museums, and gardens can help alleviate the symptoms of anxiety as natural coping strategies. Specific medications such as selective serotonin reuptake inhibitors (SSRIs), serotonin norepinephrine reuptake inhibitors (SNRIs), or benzodiazepines may be prescribed by a healthcare professional to alleviate anxiety symptoms. This is particularly helpful for individuals with severe anxiety or when combined with therapy. Overall, it is important to consult with a qualified healthcare provider to determine the treatment approach that would be most suitable for you. That's it on anxiety. If you enjoyed this video, give us a thumbs up. Also, like and subscribe to this channel if you haven't. Thanks for watching.